Hello, in this video I'm going to talk about effect of stroke on cognition. Quite often, and in my view, almost 80 to 90% people after stroke will experience a degree of cognitive challenge. When I talk about cognitive challenge, the one of the most common factors or symptoms is slow information processing. So that means people process the information much slower, particularly immediately after the stroke, what is also sometimes called acute phase. Now, this has several implications. Number one, people's understanding of what has been their challenge can be quite slow, because when people are moving around, they might not notice that their knee control is not good or their balance is not quite good. So because they are not getting the feedback immediately to the brain, their senses are maybe sending the feedback, but even that might be working slowly. But when the information comes to the brain from different parts of the body, that balance is not quite right, but the brain might not be processing it quite spontaneously. So people's awareness of their deficit can be less. Number two, it can affect people's memory, because the amount of information that is coming in, if it is coming in slower, some of the information will get missed, and as a result we may not remember what has been said or what we have seen. And this is the aspect I want to touch on today. In particular, the effect of slow information processing on rehabilitation, on the physical rehabilitation, is immense, because what happens, the physio comes and gives people 4 exercises. But by the time the physio has finished the session, the people have forgotten about it. Because in the session, when the physio is explaining what to do, that person is trying their best to copy what they have to do. They are not having the time to process it and store it in the memory. As a result, after the session, they don't do anything. Once they are home, the physio comes and says that you have to do these exercises twice. Patient says, yes, I will do it. Physio comes back next day or next week. Patient says, I haven't done the exercises. In the first place, they can't even remember. So my request to all the healthcare professionals, if you are giving an exercise rehab program to a person with stroke or brain injury, first, at the end of each session, please go through the exercises again. Repeat them to make sure the person has understood. That is the nitty-gritty of remembering the exercises. Now there's another aspect, because with any neurological conditions, if the technique is not correct, the exercise becomes less effective, and in some cases it can be detrimental. For example, if I have been asked to do this movement, now I've forgotten how to do it, and instead of that I use the compensation of doing this. That means I'm training my brain in a movement that's not normal. And when I will be walking, I will be walking sideways. So, and to do the movements accurately, we need to be able to monitor our movement, reflect on that movement, and take remedial actions on those movements. If we think about it, it requires a huge amount of cognitive resources. And when the information processing is slow, it gets very, very difficult. So my request to anybody who has had a stroke or brain injury or MS or any other neurological condition, if your physio or any other occupational therapist comes and teaches you programs, exercises, ask them after each exercises to make sure that you have understood. Or if you're a healthcare professional, you make sure at the end of after each exercise that your client has understood the exercise. And with these kind of conditions, there's no point in giving 20 exercises or 10 exercises. Give 2 or 3 exercises in a session. Increasing the awareness of the quality of movement is absolutely important. It is of paramount importance that as a healthcare professional, we increase the awareness of the person who is doing the exercises. What is their quality of the movement? Are they doing the correct technique? When they need to be careful and which point they need to be more vigilant. So those things just explaining will not work. You need to practice it repeatedly, day after day. Then only, depending on what is the degree of slow information processing of the client, you might get the person to do the exercises correctly after many days. So please don't think the person doesn't want to learn. Don't be frustrated. We need patience. As a healthcare professionals, I show the same exercise day after day after day to make sure my clients gets them correctly. We all have to be patient. The client, the healthcare professionals both have to be patient in order to make the rehabilitation program a success. It got to be a coordinated approach. Thanks for watching my video. I hope this has helped you to understand how to make the rehab program more effective. Wish you all the best.